Ma'am, I need you to step away from that patient now.
I can't do that right now. I'm stopping the bleeding.
I don't think you heard me.
Step away immediately. This man will die if I stop. Please, just seconds.
You're refusing a
Who do you think you are?
I'm a trauma surgeon. I'm trying to save his life.
Yeah, tell it to the judge. Hands behind your back.
She was helping him.
Officer Dawson had no idea what he just walked into. In the next 48 hours, his badge would be taken away. His department would face a federal investigation, and the hospital would file a $28 million lawsuit. The woman he just handcuffed was Dr. Helena Pierce. She was one of the top trauma surgeons in the country. She was also the chair of the hospital board of directors. Dr. Pierce had spent 15 years saving lives in emergency rooms. She had performed over 2,000 critical surgeries. She wasn't just a doctor. She was the doctor who helped run the entire hospital. And the security cameras were recording everything. They captured the moment Officer Dawson dragged her away from a patient who was bleeding on the operating table. Before I continue, let me ask you something. Have you ever been told you don't belong somewhere, even when you're doing exactly what you're supposed to do? Drop your answer in the comments. But Officer Dawson had no idea who he was handcuffing. Dr. Helena Pierce was 42 years old. She was the chief of trauma surgery at Metropolitan General Hospital. She was also the chair of the hospital board of directors. That meant she didn't just work at the hospital. She helped run it. Dr. Pierce went to Johns Hopkins Medical School. She graduated in the top 5% of her class. She spent 15 years working in emergency rooms across 3 states. She had performed over 2,000 critical surgeries. She was board certified in both trauma surgery and emergency medicine. She had published research on how to make trauma care better. She served on the city's medical ethics committee. She had even testified before the state legislature about protecting healthcare workers. But most people didn't know all of that. They just knew she was good at her job. The nurses trusted her. The residents looked up to her. The patients' families thanked her. She was also a single mother of 2. She worked 80-hour weeks, and she never complained about it. On this Tuesday evening in September, Dr. Pierce was just trying to save a life. She had no idea she was about to become a different kind of advocate, not for patients in the operating room, but for every healthcare worker who's ever been disrespected while doing their job. Officer Marcus Dawson had a reputation in the 14th Precinct. He was 38 years old. He had been a patrol officer for 12 years, and he had a disciplinary history. There were 7 formal complaints against him in 4 years. Every single one involved confrontations with black professionals, and none of them involved actual crimes. In 2021, he detained a black attorney outside a courthouse. He said the man looked suspicious. The man was meeting a client. He was wearing a suit. In 2022, he aggressively questioned a black school principal in her own school parking lot. He accused her of trespassing. She showed him her ID. He didn't apologize. 2 months before this incident, he complained to hospital administration about a black nurse. He said she was confrontational. She had refused to give him patient information. If she had given it to him, she would have violated federal law. The ER nurses knew about Officer Dawson. They called him badge heavy behind his back. They warned each other when he was in the building. They knew he liked to throw his weight around. Dr. Pierce had filed a formal complaint after his last visit. She wrote that his demands violated patient privacy laws. She asked the hospital to request different officers for medical calls. The hospital did ask. The police department ignored them. Now Officer Dawson was back. He had a grudge, and he had an opportunity. Type justice in the comments if you think officers with multiple complaints should be removed from duty. It was Tuesday, September 17, 2024. The time was 6:47 p.m. Metropolitan General Hospital was a Level 1 trauma center. That means it handles the worst emergencies. On this evening, the ER was busy. 3 trauma bays were occupied with patients from a car accident earlier that day. The sounds were typical for a hospital: monitors beeping, the PA system calling codes, the smell of antiseptic in the air, fluorescent lights humming overhead. Dr. Pierce was in Trauma Bay 3. She was the lead surgeon. Dr. James Chen was assisting her. He was a resident learning trauma surgery. Two nurses were helping, Angela Martinez and David Thompson. They were focused on keeping the patient stable. The patient was a 28-year-old man. He had been stabbed. He was in critical condition. He had an arterial bleed. That means a major blood vessel was damaged. He could die if they didn't fix it fast. Officer Dawson had arrived with the patient in the ambulance. He was there for a criminal investigation. Hospital protocol said he should wait outside. He didn't wait. At 6:43 p.m., he walked directly into Trauma Bay 3. He ignored the restricted area signs. He walked up to the operating table. "I need to question this patient," he said, "right now." "Doctor." Pierce didn't look up. She was in the middle of a suture. "Not now, he's unstable." "This is a police investigation. I need information now." Dr. Pierce kept working. "You can have information when he's not bleeding out on my table." That's when everything changed. If stories like this matter to you, hit that subscribe button. Officer Dawson stepped closer to the operating table. He was now standing in the sterile field. That's the clean area around a patient during surgery. He wasn't supposed to be there. "Ma'am, I need you to step away from that patient, now." Dr. Pierce's hands didn't stop moving. "I can't do that right now. I'm in the middle of something." His voice got louder. "I don't think you heard me. Step away." She was focused on stopping the bleeding. "This person is bleeding. I need a few more minutes." He interrupted her. "Are you refusing a direct order? Who do you even think you are?" She finally looked up at him. "I'm just trying to help someone who's hurt." Nurse Martinez stepped forward. "Officer, you need to wait outside. You're contaminating the sterile field." Dawson glared at her. "Stay out of this." Then he turned back to Dr. Pierce. "You're coming with me, hands behind your back." Dr. Pierce's eyes went wide. "Wait, you can't. You're under arrest for obstruction. Let's go." He grabbed her arm. She was still wearing bloody gloves. He started pulling her away from the patient. Dr. Chen shouted, "What are you doing? She's in the middle of surgery." Nurse Thompson immediately stepped in. He took over the suture. Someone had to keep the patient from bleeding out. Security guard Marcus Williams saw what was happening. He ran toward Trauma Bay 3. A patient's family member was standing in the hallway. She pulled out her phone. She started recording. Officer Dawson pulled Dr. Pierce's arms behind her back. He put handcuffs on her. She was still wearing her surgical gown. It was covered in the patient's blood. Her gloves were still on, and the patient on the table was still bleeding. A code gray was called over the hospital PA system. That's the code for a security threat. 3 more security guards came running. The hospital administrator, Dr. Patricia Hernandez, got an emergency page. The whole thing happened in less than 2 minutes. One moment Dr. Pierce was saving a life. The next moment she was in handcuffs. And Officer Dawson looked satisfied with himself. He thought he had just arrested someone who didn't respect his authority. He had no idea what was about to happen. Let me know in the comments what you would have done if you saw this happening. Dr. Hernandez came running into the trauma bay. She was the hospital administrator. When she saw Dr. Pierce in handcuffs, her face went white. "Marcus, do you know who this is?" she asked. Officer Dawson shrugged. "I don't care who she is." Dr. Hernandez took a breath. "This is Dr. Helena Pierce. She's the chief of trauma surgery, and she's the chair of our hospital board." Most people would have been embarrassed, not Officer Dawson. Then she should know better than to obstruct a police investigation. The witnesses started speaking up. Dr. Chen was still working on the patient. She was literally saving a man's life. The patient was unstable. She couldn't stop. Nurse Martinez stepped forward. "Officer Dawson violated protocol by entering the trauma bay. We told him to wait outside 3 times. He refused." Security guard Williams pulled up the footage on his tablet. "I have him on camera walking past the restricted area sign. He knew he wasn't supposed to be in there." The family member in the hallway was still recording on her phone. "I saw the whole thing. She never raised her voice. She was calm. She was just trying to save that man." The evidence was everywhere. 4 security cameras had captured different angles. The family member had cell phone video. Dr. Pierce was wearing a body camera. Many hospital staff wear them during trauma cases. It's for medical and legal documentation. The electronic medical records showed exactly what was happening with the patient. His vitals were critical. He needed immediate surgery. There was no time to wait. The badge scanner logs showed when Officer Dawson entered restricted areas. He didn't have authorization. Dr. Chen had to take over the surgery mid-suture. When Officer Dawson pulled Dr. Pierce away, the patient's vitals dropped. They had to give him an emergency transfusion. The disruption put his life at risk. Within 15 minutes, things started moving fast. The hospital's legal counsel was contacted. Hospital board members were notified. Someone called the police chief directly. Officer Dawson's supervisor arrived 20 minutes after the arrest. Her name was Lieutenant Sarah Brooks. She had been on the force for 15 years. She walked into the trauma bay and asked to see the footage. She watched the security camera video. Her expression changed from confusion to horror. She turned to Officer Dawson. "Marcus, do you understand what you just did?" His confidence started to crack. She was interfering with my investigation. Lieutenant Brooks shook her head. She was performing emergency surgery, on camera, with witnesses, on the chair of the hospital board. He tried to defend himself. "I was just doing my job." "Your job is not to arrest doctors in the middle of surgery." By now, Officer Dawson was starting to understand. He had made a huge mistake, but it was too late to take it back. Within 45 minutes, Police Chief William Martinez arrived at the hospital. The Deputy Chief of Internal Affairs came with him. Her name was Captain Angela Rodriguez. They reviewed everything, all the security footage, all the witness statements, the hospital protocols, the patient's medical records, Officer Dawson's previous complaint from Dr. Pierce. "Wait until you hear what they decided to do." Chief Martinez interviewed Dr. Pierce first. She was still in her bloody scrubs. She had handcuff marks on her wrists, but she was calm. He asked her to describe what happened. She did. She didn't raise her voice. She didn't exaggerate. She just told him the facts. Then he interviewed the 4 witnesses. Their stories all matched. He reviewed Officer Dawson's claims, 3 of them. Claim 1. She refused to comply with a lawful order. The security footage showed something different. Dr. Pierce explained calmly that she was in the middle of surgery. She never raised her voice. She never physically resisted. She just said she couldn't stop right then. Claim 2. I needed to question the suspect immediately for public safety. The patient was unconscious. He was intubated. That means he had a breathing tube down his throat. He couldn't talk. He couldn't have been questioned anyway. There was no immediate threat. Claim 3. She was being confrontational and aggressive. Dr. Pierce's body camera footage told a different story. She spoke in measured tones. She stayed focused on the patient. Officer Dawson was the one who escalated. He was the one who got loud. Every claim fell apart. Chief Martinez made his decision on the spot. Officer Dawson was placed on administrative leave immediately. They took his badge. They took his weapon. A formal internal affairs investigation was opened. The hospital issued a formal trespass notice. Officer Dawson was banned from the premises. Dr. Pierce gave a statement to the chief. "I want to be clear. This isn't about me being embarrassed. This is about a police officer who put a patient's life at risk. He did it because he couldn't handle being told to wait. If I hadn't been who I am, would anyone have cared? If I'd been a resident or a nurse or a medical student, would you be here right now?" The chief didn't have a good answer for that. Officer Dawson tried to defend himself again. "This is ridiculous. I was doing my job." "You arrested a doctor during surgery, Marcus. You're going to believe her over me." Lieutenant Brooks cut him off. "Marcus, this is your 8th complaint, and this time you arrested a doctor during surgery while cameras were recording, with witnesses everywhere." He tried one more time. "I have 12 years on the force. This is one incident." "No," Lieutenant Brooks said. This is the 8th incident, and this time you can't talk your way out of it. Dr. Pierce refused medical treatment for her wrists. She went back to check on her patient. He had been moved to the ICU. He was in critical condition, but he was stable. Dr. Chen and Nurse Thompson had saved his life. The hospital staff gathered around Dr. Pierce. Several nurses were crying. They hugged her. They told her they were sorry. They told her she didn't deserve that. Within hours, the hospital issued an internal memo. New protocol for police interactions in trauma bays. No officer enters a restricted area without authorization. Period. But the story wasn't over. Someone had been recording, and that video was about to go everywhere. If you haven't already, hit that subscribe button because this gets even bigger. The family member who recorded the arrest uploaded it that night. She posted it to Twitter and TikTok at 8 p.m. By 9 p.m., it had 50,000 views. Local activists shared it. Healthcare worker accounts shared it. By 11 p.m., it was trending on local Twitter. The hashtag was Justice for Dr. Pierce. By 2 a.m., it had 500,000 views across all platforms. National medical organizations were sharing it. By 6 a.m. Wednesday morning, local news was running the story. By noon, it had 2.3 million views. CNN and MSNBC were covering it. By Thursday, it had 8 million views across TikTok, Twitter, Instagram, and YouTube. The numbers kept growing. On TikTok alone, it got 4.2 million views. It got 890,000 likes. It was shared 45,000 times. On Twitter, it got 3.1 million views. It was the #1 trending topic nationally. The comments were overwhelming. A doctor with 5 million followers wrote, "This is every healthcare worker's nigh. GH Mayor, we take an oath to do no harm." She was literally saving a life. A civil rights lawyer with 2 million followers wrote, "Clear case of abuse of power with racial bias. Badge plus ego equals danger." The National Nurses Union posted, "Dr. Pierce represents what we face daily: disrespect, interruption, and now arrest for doing our jobs." Thousands of nurses and doctors shared their own stories. Stories of police officers demanding things that violated patient privacy. Stories of being questioned about why they were in certain areas of their own hospitals. Stories of being treated like they didn't belong. Every local news station led with the story. CNN ran a segment. MSNBC ran a segment. ABC News covered it. Medical trade publications wrote opinion pieces. Court TV did legal analysis. The hospital issued a statement within 24 hours. "We stand firmly behind Dr. Pierce. Her actions were heroic and professional. We are cooperating fully with investigations, and we are reviewing our protocols to prevent this from ever happening again." Officer Dawson's police union tried to defend him. They issued a statement saying he followed procedure. The internet destroyed that statement in minutes. Thousands of medical professionals explained exactly why he did not follow procedure. 3 days later, Officer Dawson hired a lawyer. He gave an interview. He claimed he was the real victim. That interview would become evidence in the lawsuit. Comment below if you think this officer should have been fired immediately. On October 15, 2024, Dr. Pierce and the hospital filed a lawsuit. It was a federal civil rights lawsuit. The defendants were Officer Marcus Dawson, the police department, and the city. The claims were false arrest, violation of civil rights, assault, battery, intentional infliction of emotional distress, and interference with medical care. The amount was $28 million, $15 million in compensatory damages, $13 million in punitive damages. During discovery, they found Officer Dawson's pattern. Internal Affairs had 7 previous complaints against him. 6 of them involved black professionals. The department had flagged him for bias training twice. He never completed it. They recovered text messages. He had made racist comments about hospital staff. They found evidence that he specifically requested assignment to hospital calls. Lieutenant Brooks had tried to rotate him out. He fought to stay. There were 47 pages of evidence. There were 12 witness depositions. The county DA filed criminal charges: misdemeanor assault, false imprisonment, obstruction of medical care. The state medical board opened an investigation. They were looking into whether he endangered the patient. The case moved fast. By April 2025, they reached a settlement. The city paid Dr. Pierce $4.2 million. They paid the hospital $800,000 for legal fees. They paid the patient whose care was disrupted $50,000. The total was over $5 million. Officer Dawson was personally ordered to pay $150,000. It would be taken from his pension. He was banned from all hospital properties in the county, lifetime ban. In January 2025, he was fired from the police force. He lost his pension benefits, not just the $150,000. His pension was reduced for misconduct. He was barred from law enforcement in the entire state. His name was added to a national police misconduct database. He pleaded no contest to the misdemeanor charges. He was sentenced to 6 months of home confinement, 200 hours of community service at medical clinics, 3 years of probation, and a restraining order. He couldn't go near Dr. Pierce or the hospital. The police department faced consequences too. A federal consent decree required bias training for all officers, new hospital liaison protocols, and discipline for supervisors who ignored previous complaints. As part of the settlement, Officer Dawson had to issue a written apology. He did. But 2 weeks later, he gave another interview. He said he still believed he acted appropriately. Dr. Pierce's lawyers immediately filed a motion. They said he violated the settlement agreement. Dr. Pierce held a press conference. This was never about money. This was about accountability. Every day, healthcare workers face disrespect and violence. Most don't have the platform I have. This settlement sets a precedent. You cannot disrupt medical care without consequences. But the story didn't end with the money. In June 2025, Dr. Pierce addressed healthcare workers and the press. She spoke in a hospital conference room. "I'm a trauma surgeon," she said. "I've held people's lives in my hands for 15 years, but I've never felt as powerless as I did in that moment, being handcuffed and dragged away from a patient who needed me. The physical marks healed in days. The psychological impact took months." She paused, then she continued. "I had resources most people don't have. I had a title, I had a legal team, I had institutional support, I had public attention, but think about the residents, the nurses, the EMTs. They face this kind of disrespect every single day, and they have nowhere to turn. If this could happen to me, what happens to them?" Her voice got stronger. "You have rights. You have dignity. You do not deserve to be threatened or arrested for doing your job, and if someone in power tells you otherwise, they're wrong." She looked directly at the camera. "A badge does not give you the right to endanger patients. A uniform does not make you immune to accountability. Respect is not optional. It's basic human decency." She outlined what she wanted changed: mandatory training for all officers on healthcare facility protocols, independent oversight when police interact with medical staff, legal protections for healthcare workers who refuse demands that violate patient care. To the nurses who stood up for me, to the resident who took over my patient, to the hospital administration who backed me immediately, and to the thousands of healthcare workers who shared their stories, thank you. You reminded me why we do this work. She ended with this: "We save lives, that's our job, and no one should ever be punished for that." This case exposed something bigger. Almost half of all nurses report workplace violence. 2/3 say it's getting worse. Black doctors face discrimination at 3 times the rate of white doctors. Healthcare workers are 5 times more likely to experience violence than workers in other fields. Dr. Pierce had power and resources most healthcare workers don't have. The incident was captured on multiple cameras. The hospital backed her immediately. That usually doesn't happen. After this case, policies changed. Metropolitan General implemented new protocols. Other hospitals followed. 8 major hospital systems adopted similar rules within 6 months. but we still need federal laws protecting healthcare workers from arrest during emergency care. We need to end qualified immunity for cases involving patient care interference. We need national standards for police training in hospitals. So let me ask you, do we believe healthcare workers deserve protection while they're saving lives? Do we believe anyone, regardless of their badge, should face consequences when they endanger patients? Do we believe a black woman doctor should be able to do her job without being arrested for it? Because if we don't address the racial bias in these authority interactions, if we don't protect healthcare workers from violence, then we're just waiting for the next Officer Dawson, the next Dr. Pierce, the next patient who almost dies because someone's ego mattered more than their life. Comment below if you believe healthcare workers should be legally protected from arrest while performing emergency medical care, because right now, in most states, they're not. If you think stories like this matter, hit that subscribe button. We're going to keep exposing these patterns. We're going to keep demanding better. We're going to keep fighting for accountability, for respect, and for a system where saving a life is still the most important thing in the room. This isn't just about one officer or one doctor. It's about all of us and the society we're willing to tolerate. See you in the next one.